aware, sheep and goats can transmit zoonotic diseases. The first set of diseases that we will go over are spread through direct contact. These diseases will be passed on through directly touching an infectious material or animals. Some infectious materials may include gates, feed buckets, and animals themselves. The first disease is Q fever. Q fever is caused by the bacteria Coxiella burnetii. This disease is most common during birthing season, since the bacteria can be passed through the birthing material of infected sheep or goats. The bacteria can also be aerosolized and carried through the air. Q fever can also be passed by urine, feces, and infected milk products. Symptoms for humans can include fever, chills, tiredness, muscle aches, diarrhea, vomiting, or a low-grade fever. Animals can show no signs of Q fever, and if they do, symptoms may include weight loss or spontaneous abortions. Treatment for Q fever is antibiotics. The next common zoonotic disease is ORFs. ORFs is also commonly known as sore mouth. ORFs is a disease that is found worldwide in sheep and goats. ORFs is transmitted through cuts on the skin and getting infected material into the cut. It can also be transmitted through casual contact with sheep and goats. In sheep and goats, the infection can also be seen around the udders when the lambs and kids are nursing. And humans, ORF symptoms are sores on the top layer of skin. People may also have mild fever, fatigue, and swelling. ORFs cannot be passed from human to human. Animals infected with ORFs will have sores on their lips, muzzle, and mouth. Treatment for ORFs is non-specific and will vary based on severity. The next disease we will talk about is ringworm. Ringworm is caused by a fungus that will make a ring-like rash on the skin and hair. Ringworm is passed by being in contact with animals who are infected. This contact can be petting, walking, or just casual contact. Ringworm symptoms in humans can consist of itchy skin, ring-shaped rash, red, scaly, cracked skin, and hair loss. These symptoms will vary based on where you are infected on the body. Animals will have hair loss around the ears, face, or legs. Treatment for ringworm will be using a topical antifungal. Our final direct contact disease is pink eye. Pink eye can be caused by many bacteria such as mycoplasma and chlamydia. There are only certain bacteria that are zoonotic. Transmission of pink eye can occur from direct contact with sheep and goats. Sheep and goats can also pass the bacteria through sharing waterers, close contact, and from sharing feeders. Symptoms in humans can include red eye, discharge, decreased vision, and eyelid swelling and pain. Animals can show signs of pink eye can be clouded eyes, light sensitivity, ulcer, and temporary blindness. Treatment for pink eye is antibiotics. Fecal oral route is a common route of infection that can happen if the animal is dirty or has been sitting in the fecal matter, or if the fecal matter on gates has not been cleaned yet. The two common diseases that we will talk about are E. coli and Salmonella, which may be more familiar to people, although you may only associate these with undercooked meats. These can be transferred by working with the live animals also. E. coli is naturally found in the intestines of humans and animals. There are many different types of E. coli, and most are strains that are harmless. Symptoms in humans can include stomach cramps, diarrhea, and chest pains. Animals may not show any symptoms or can show signs of mild diarrhea. Treatment in humans in many cases will include rest and fluids. Treatments in animals will be supportive care based on symptoms they are showing. Our final disease that we will talk about is Salmonella. Salmonella is a bacteria infection that can cause symptoms in as little of 6 hours to 6 days after infection. People who are most at risk are those who are older adults, younger children, pregnant people, and immunocompromised individuals. Some symptoms that humans may see is fever and abdominal cramps. Animals may be asymptomatic, or they can show mild signs of diarrhea. To treat Salmonella, then you should use antibiotics and fluids. Thank you for watching, and if you have any specific concerns of zoonotic disease in your area, please contact your local veterinarian or your county extension office.